All right, hockey fans, this video is for you guys. I've talked about covering hockey on this channel, and so I'm really excited to bring you this first video. And what better injury to take a look at than one that was so devastating and high speed and high impact that even the player thought that he had surely broken his leg. That's right, we're gonna be talking all about Connor McDavid and his PCL injury. What's up, everybody? Welcome back. For those new, my name is Brian, and I'm a doctor and a sports fan, and it's my goal on this channel to combine those two interests to help explain different sports injuries and sports medicine topics in a way that's easier for you guys to learn from and understand. Don't worry, if you're not a hockey fan, I still encourage you to check this out because this injury is something that could happen to your favorite player, and so it might be helpful to learn a little bit more about what's going on and why it can happen. Right in the moment, we saw him even mouth the words on the ice, "It's broke," thinking that he had broken his leg just because of the impact and how much pain he was probably in. We thankfully found out that he hadn't broken his leg, but MRI did show that he has a PCL injury, and so we're going to talk about that in today's video. We'll review the anatomy and talk about why the ACL and the PCL are different and why that makes them at different injury risks. We'll review the footage from McDavid's injury to explain the mechanism of why the PCL got injured, and then we'll talk about why it's possible that he doesn't need surgery to heal from this injury. As always, hit that subscribe button if you guys like this type of content and want to see more in the future, and let's get started. We're going to dive straight into the inside of the knee for our anatomy to focus on the ACL and the PCL. The primary function of these two ligaments is to prevent forward and backwards movement between the femur on top and the tibia on the bottom. The PCL in particular stands for posterior cruciate ligament, posterior meaning back or behind, and its primary job is to prevent the tibia from sliding backwards in relation to the femur, as shown with this arrow. The ACL is the anterior cruciate ligament, meaning in the front, and its function is the opposite, preventing the tibia from moving forward. Interesting thing here that most people don't realize is the PCL actually has two distinct bundles associated with it. There's the anterolateral bundle and then the posteromedial bundle, and depending on the exact amount of flexion in the knee, depends on which of these two components of the ligament are really providing the majority of structural support. In general, PCL injuries are much less common than ACL injuries, and one of the reasons for that is that the PCL is overall a bigger and stronger ligament. It's the strongest ligament that we have inside our knee, and some estimates up to twice as strong as the ACL. Usually when someone gets a PCL injury, it's in combination with some other ligamentous damage in the knee, and we don't know if McDavid had any other additional stuff going on, but they said PCL, so we're gonna focus on that. Let's get next to the footage and look at how this can happen and why it happened with McDavid. PCL injuries most often happen in traumatic settings, and the kind of textbook situation is a car collision where someone's knee slams into the dash. Remember back, the PCL is preventing the tibia from moving backwards in relation to the femur, and so any sort of collision or trauma that puts additional pressure pushing that tibia backwards can overly stress and damage the PCL. Looking at the shot here, when McDavid goes sliding in, we can see that knee is bent, and then that goalpost hits just high up enough on the tibia that it pushes the tibia back and causes this excessive force pushing the tibia backwards, ultimately stressing that ligament beyond what it can support and maintain. Now, this was so painful, we even saw him mouth the words on the ice, "It's broke," and everybody was convinced and thought that he had a fractured bone, and it wouldn't have been surprising with as much pain as he was in. And side note here, a lot of hockey fans criticize other athletes for not being able to play through things that don't seem very severe, like that aren't broken bones or anything like that. And this is a perfect example of an injury that wasn't a broken bone. It was just a ligament that doesn't even need surgery that in and of itself caused him so much pain that he wasn't able to skate and play on the ice. Even if he had tried to skate and work through the pain, he would have had some instability in that knee that it wouldn't have been safe, and he would have been at further risk of hurting himself even worse. And so, pain or no pain, it was best in that situation that he didn't continue trying to push through and skate through the pain. So whenever you see an injury in a different sport, try to not judge it based on what you think might be more severe, because some of the injuries that are the least painful can actually have the most impairment in function and prevent you from being able to play your sport and put you at risk of more injuries. You guys are probably familiar with how we grade muscle strains or ligament sprains on this kind of 1 through 3 scale, with 3 being the most severe, and you can similarly grade PCL injuries as well. In this case, a grade 3 injury is a complete tear. One of the ways the doctors will assess for a PCL injury is something called the posterior drawer test, where they basically have the athlete lay on a table, bend their knee up, and then take their hands and push backwards on the tibia, seeing how much it moves. Based on that amount that the ligament is lax and able to move the leg, is how you grade it a 1 or a 2. The great thing is, oftentimes, unless it's a complete rupture, these don't need surgery to be managed. One of the big reasons for that is the PCL has really good intrinsic healing properties because it has good blood supply compared to something like the ACL. Whenever you get this partial tear in the ligament, essentially the body goes in and tries to form scar tissue to build up that gap and provide that strength back in the ligament. The more blood supply that you have, the easier this is to do. So it's not unusual for an isolated PCL injury to be managed without surgery. What they'll do is they'll try to put the player in a brace that prevents the tibia from moving backwards in relation to the femur to try and let that ligament heal up in the proper position. There's a specific brace called a dynamic anterior drawer brace that they'll often wear in these situations. And you're in that brace long enough to try to let that ligament scar up so that it can heal properly. During the rehab, what someone like McDavid is going to be doing is focusing primarily on quadriceps strength or knee extensor strength. Whenever one of these ligaments in the knee is damaged, the rest of the body tries to compensate through its muscles. If we think to where the quadriceps muscle attach, it comes down and attaches on the front of the tibia. So whenever the quadriceps contracts, if anything, it's pulling the tibia a little bit forward, so in the opposite direction of the PCL. So you can think of the quadriceps as sort of a substitute for the PCL, because by contracting it, it's going to prevent that tibia from moving backwards like the PCL would be trying to do. Oftentimes in the rehab protocol, you're initially in this brace to encourage that initial healing. But then oftentimes once you can get your quadriceps muscle strength up to a certain level, usually around 90% of the other side, then you can start getting back to some activities. These aren't very long injuries. Oftentimes people can get back between 1 and 3 months, just depending on how quickly they're able to develop that strength in their quadriceps muscle and give that ligament time to heal. If you've seen my other videos talking about the risk of things like arthritis after an ACL tear, then you might be wondering, with a PCL tear, is it a similar concern? Well, yes. Anytime you change the biomechanics or the structure of the knee, you put it at risk of other injuries or things like arthritis. But it's not as bad in the case of a PCL tear as it might be with an ACL tear. Kind of one of the gold standard studies that followed these types of injuries really long term looked at 44 patients at an average of 14-year follow-up and found a presence of arthritis at only about 11%. Now, we don't know, of course, how many of those people would have naturally had arthritis, but there doesn't seem to be an overly huge risk of arthritis with a PCL tear compared to something else like an ACL and a meniscus. You certainly do still have added risk of things because you've changed the structure of the knee, but it's not as much of a concern. Similarly, there's no real difference between surgery and no surgery in terms of what the literature says about developing something like arthritis. So I wouldn't expect McDavid to miss too much time and probably would be ready for the next start of the season. They'll work on that quadriceps strengthening and then get him back on the ice, and that PCL should heal down well so that there's really no deficits or issues going forward. He definitely avoided some other really bad stuff with how severe this injury looked, so I'm happy that this was minor enough that he doesn't need surgery and can get back on the ice soon. So that's it. Really excited to bring you guys a hockey video. I've got some others in mind that I'm going to talk about. If you have any specific suggestions, be sure and let me know. If you're not a hockey fan but you watch this video anyways, thanks. Appreciate you guys hopefully learning something new about a different injury we haven't covered. Leave comments, questions below. Love interacting with you guys as always, and until next time, we'll see you later. Bye.